Hello everyone, myself Himani Sharma from RPIIT campus. In today's class, I discuss about the pulmonary embolism. Thrombi most often arise from the deep vein in the leg, the right side of the heart or pelvic area, and travel to the pulmonary circulation. Can also be air, fat, amniotic, medical emergency, risk factors, immobility, bed rest. There are the history of previous DVT, pre-post, op trauma, pregnancy, obesity, BC pills. Assessment findings. Severity of the symptoms depend on the size and location. Acute onset of chest pain, dyspnea, tachypnea, anxious feeling of impending doom, tachycardia, rales, crackless, diminished breath, sounds, cough. Death can occur within 1 hour of onset of symptoms. May have history of DVT. Diagnostic finding: ventilation, perfusion, scan, pulmonary angiography, CXR, ABGS, peripheral vascular studies. Next is prevention: active leg exercise, early ambulations, pneumatic elastic compressions, stockings, avoid sitting, leg crossing, and teach the text signs, symptoms of DVT and PE, low dose anticoagulant for those undergoing surgery. Next is the medical management. Emergency management stabilize the cardiopulmonary system. Nasal oxygen, ABGS, I. There are the 4 lung perfusion scan or spiral CT scan. Continuous cardiac monitoring, vital sign. Hemodynamic monitoring, treat hypotension using the dobutamine or the dopamine. Next is the medical management continuous. IV morphine, compression stockings, anticoagulant, heparin bolus strip, low molecular weight heparin, comedine, thrombolytics, urokinase, streptokinase, altiplase, retiplase, TPA are the medical management for this. Next is the surgical management. If P is severe, embolectomy, umbrella filter, greenfield filter. Nursing management, minimize the risk of PE, that is pulmonary embolisms. Always suspect PE, prevent formation of the thrombus. Major nursing responsibilities: leg exercise, early ambulations, and no sitting or laying for long period of time. Legs should not be in dependent positions. Monitor the foresight. Next is the nursing management, monitoring the anticoagulant during infusion, bed rest, vital signs, O2 seat, limit invasive procedures, monitor PT and PTT, monitor for bleeding, pain management, anxiety management, monitor for the complications, cardiogenic shock, right ventricular failure, education, chest trauma blunt, more common, harder to determine the extent causes, the sudden compression or positive pressure to the chest wall, MVAs, steering wheels, seat belt falls, bicycle crashes. Next is the types: fractured sternal and ribs, flail chest, pulmonary contusion. Next is the chest trauma penetrating, causes a foreign object enter the chest wall, gunshot and stabling. So in today class I discuss about the two disease, like first is the pulmonary embolism and next is the chest trauma. Thank you for watching.